Hello everyone, myself Sujit Sanjay Patil, faculty Shri Jain Vidya Prasarak Mandals, Rasiklal M. Dhariwal, College of Pharmacy, Chinswad, Pune. In this video, we are going to discuss about the topic named as coagulant and anticoagulant. Contains introduction, therapeutic uses, pharmacokinetics, and adverse effect of coagulant and anticoagulant. Introduction. What is hemostasis? Stoppage of bleeding from vessel at the site of injury. There are three steps. Initially vasospasm of small capillary, formation of platelet plug and blood clot. That is formation of blood clot. Coagulation. Complex process of enzymatic reaction in which clotting factors activate other clotting factor in a fixed sequence until a clot is formed. Disorder of coagulation can lead to an increased risk of bleeding or clotting, that is known as thrombosis. Three stages of coagulation. First, extrinsic. Second, thrombin formation, and third is fibrin formation. Coagulants. Coagulants substance which promote coagulation indicated in hemorrhage stages, that is hemophilia, von Willebrand's disease. Fresh whole blood or plasma based therapy for deficiency of any clotting factor but carries the risk of HIV hepatitis transmission. They act immediately. Hemophilia, that is anti-hemophilic factor. Fibrinogen, hemophilia, acute fibrinogenemia, and IV infusion. Desmopressin, analog of vasopressin used in von Willebrand disease, stimulate release of VWF from endothelial cells. IV subcutaneous intranasal, no risk of HIV and hepatitis. Deficiency. Liver disease like obstructive jaundice, malabsorption, long-term antimicrobial therapy which alter the intestinal flora. Deficient diet is not most common. Lowering of the levels of prothrombin and other clotting factor. Therapeutic uses 5 to 10 mg day orally parenterally. Newborn vitamin K by intramuscular route up to 1 mg. Deficiency due to chronic use of antibiotics. Antidote to oral anticoagulant. Osteoporosis adjuvant. Therapeutic uses: overdose of fibrinolytics, traumatic and surgical bleeding, prostatectomy, tonsillectomy, tooth extraction, embryo placentae PPH menogoria, recurrent epistaxis, adjuvant therapy in hemophilia. These are the therapeutic uses of coagulant and anticoagulant. After that, we see the adverse reaction: vomiting, diarrhea, abdominal discomfort, dyspnea, hypotension, conjunctival arrhythmia, nasal stuffness. These are the adverse reactions of coagulant and anticoagulant. Now see anticoagulants. Anticoagulants drug which help prevent the clotting of blood, prevent formation of new clots or an existing clot from enlarging. They don't dissolve already formed blood clot natural. Prostaglandin PG12 platelet aggregation. Antithrombin inactivate factor 2 heparin sulfate, not heparin, increase activity of antithrombin. Protein C inactivate 5. Drugs used in vivo. Parenteral anticoagulant. Indirectly thrombin inhibitor heparin low molecular weight heparin fondaparinux, danaparoid, heparinidoase heparin sulfate, dermatan sulfate. Direct thrombin inhibitor hirudin, lepirudin, and crod. Oral anticoagulants. First, coumarin derivatives. Second, indadione derivatives. The example is phenyldione. Pharmacokinetics. Large, highly ionized molecule, therefore not absorbed orally by intravenously by subcutaneously injection after 60 minutes. Do not cross blood-brain barrier or placenta. Safe in pregnancy. It is metabolized in liver by heparinase. Fragments are excreted in urine. Adverse effect of anticoagulant: bleeding, alopecia, hypersensitivity, teratogenicity, heart defect, nasal breach, growth retardation, warfarin poisoning. Treatment of adverse effect of anticoagulants: give fresh blood transfusion, clotting factor and lost blood. Give vitamin K specific antidote, but it doesn't act immediately. It takes 6 to 24 hours for clotting factor to be resynthesized and re-released in blood. Therapeutic uses of anticoagulant. Heparin and warfarin both are started initially, later heparin is discontinued after 5 days and warfarin continue. Warfarin action starts only after 3 to 4 days. Uses: prophylaxis of deep vein thrombosis and pulmonary embolism in bedridden patient and those undergoing knee, hip replacement surgeries, myocardial infarction, unstable angina, rheumatic heart disease during bypass surgery, vascular surgery, prostatic heart valve surgery, retinal vessel thrombosis, and hemodialysis. Thank you.